With the possibility of a second wave of COVID-19 in the fall, Canada's public health experts are working to stop the spread. And they're now turning to genetics as a quicker way to locate outbreaks and stop the virus before it infects other groups of people. For more on how it could work, we're joined by Andrew McArthur, Director of the Biomedical and Commercialization Program at McMaster University. Thank you so much. This is a really interesting topic. I don't think a lot of people know too much about it, so thanks for breaking it down for us. How can genetics be used to better control a possible second wave?
Yeah, so everything we do when we combat viruses, whether it be a coronavirus and a flu, really depends on the genetic code of that pathogen. So when we design vaccines, it's really based on what the targets the genetic code does. So some viruses evolve very quick. We know in influenza, we have to rebuild the vaccine every year. This virus evolves very slowly, but just enough that as it moves from patient to patient, it gets subtle differences, so it starts to look like a fingerprint. So if we take the infections of two people and the fingerprint in the virus looks very similar, either they cross-infected each other or they were at a spreading event, a group of people that someone was positive at.
So we know that this virus can affect anyone, but the largest outbreaks in the country were at long-term care homes. How could this genetic mapping be used to stop that from happening again?
Yeah, so this is a critical question, and it applies now as we start to open up, indoor facilities, same thing, spreading events. If you get an outbreak in long-term care, you don't know if that's just one case coming in the door that's then spreading amongst the population, or is it coming in from the community multiple days, on a Tuesday, then a Friday, then the following Wednesday. If it's reseeding from the community, that's a very different infection control problem than just an outbreak based on a single patient and spreading. You can use these fingerprints to then try to trace those dynamics to see that if the strain circulating in the facility is really the same strain, really a one-time event, or really reflects the diversity that's in the community, which is really a community infection control problem.
Now, you say that this type of genetic mapping will work well for COVID-19, but not as well as for tracking influenza. Why is that?
Yeah, it's a bit tricky. So we actually want the coronavirus virus to evolve very slowly, because that means the targets that all these vaccines are being developed will still be there. It'd be nothing worse than spend millions of dollars in 2 years to bring a vaccine and find that the target's gone. That's the trouble with influenza. It evolves so quickly that we have to do that re-engineering every year. So that's the good news about this. But we do want it to evolve enough that we can start to figure out these fingerprints. We can start to figure out transmission patterns, especially going forward as we open up. If we get flare-ups, we want to know, is this really just in the community? Is it travel among the province, travel between provinces, or even tourism crossing borders?
New tools, new technologies, they cost money, and the federal government has put $40 million towards this project. Is that enough money for you to do what you need to do? Where are you in terms of mapping and tracing the current cases in the country?
Yeah, so this is a global effort. Many countries are doing this. Canadian scientists and public health people get it right off the mark. We really didn't wait for the federal money to come, so there is some Canadian data available already. But the federal government has put $40 million. Half of that is to go through the detective work around the virus itself. That, we hope, is enough funding to sequence every positive case in the country. This is expensive, but we've been driving the price down and making it quicker and cheaper. The important part is also half of that funding is to look at the patients. So this virus is very similar. So the virus in many ways is the same virus, even though it's subtle differences. So really why some people get very sick and some people get only mild symptoms really might have to do more with their genetic predisposition as opposed to the virus. So $20 million is also being spent to sequence the patients so we can understand why different people have different outcomes.
Andrew, about 30 seconds left, but when you say about a number of countries are working on this around the world, are they working in conjunction with each other, in parallel, or is there a fear of overlapping work and redundancy?
This has been remarkable. This is the gloves are off when it comes to normal science. The collaboration globally is remarkable. The collaboration within Canada and public health, academics, industry is remarkable. So there is a global resource of sharing data, sharing techniques, of everybody sharing their improvements. So really, it's a global as well as regional collective effort.
I love ending a story with good news, positive news. Andrew, thank you. The best of luck. Thank you so much for being here.
Thanks so much.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.